So you've been told stem cells can cure everything from arthritis to aging. But here's the truth. 80% of people who ask for stem cell therapy shouldn't even be getting it. Let's see if you're one of them. Every week, people spend thousands chasing a miracle. Some change their lives, others waste everything. The difference? Knowing if stem cells are actually right for you. I've worked inside regenerative medicine clinics across continents. And let me tell you, for every life changed by stem cells, there are 3 people who were sold hope instead of science. This video could save you thousands of dollars and possibly years of disappointment. So let's begin. Let's start with the question of why everyone thinks they're a candidate. Stem cells have become the golden child of modern medicine. Open Instagram or open TikTok, and you'll find dozens of influencers claiming stem cells fix their back pain, reverse their age, or change their energy. Then there are clinics, some good, some not so good, that use vague testimonials to hook people, promises of anti aging, recovery, vitality, but very few explain how it actually works or if it even applies to your condition. People are desperate, especially when conventional medicine fails. And when someone hears that a wellness influencer or an athlete tried stem cells and feels amazing, they think it'll work the same for them. But this therapy isn't a one size fits all. And unless your case is a match, it won't matter how many influencers swear by it. So let's get to it. Let's start with Group A, the ones who can't even physically do it. Group A is the smallest but the most medically important. This is people who should not get stem cells, at least not yet. They have to wait until they are stable. If you're immunosuppressed due to HIV, chemo, medication, stem cells can backfire. You need a strong enough immune system to handle cellular signals. Active infections are also a no-go. Whether it's bacterial or viral, the immune system is already occupied. Stem cells may confuse or weaken your response. The next ones are the ones who are dealing with certain blood disorders, clotting issues, or uncontrolled diabetes. Also make therapy riskier. And here's a detail few mention. Some poorly regulated labs use fetal serum or bovine proteins in their cell prep. There's little things that you're looking right now at the screen. And if you've developed antibodies to this, it can trigger a massive immune flare. This is why screening matters. A real clinic will check your history, ask about your conditions, and check allergies. A fake one will just swipe your card. Now, let's talk about Group B. These are the people who are being sold a dream. First, we have cancer patients. Stem cells are not approved for treating cancer. Yes, there's trials being conducted, but still, everything is in the experimental phase. In fact, right now, giving someone stem cells during or after chemotherapy can be dangerous and unethical. Second, full blown bone on bone arthritis. At that point, you're better off with surgery. Stem cells need something to work with, some remaining tissue. Without that, they're kind of wasted. But if you're looking for a little bit of pain management and you have the money to do it, they could definitely be a fit, but it's not a long term solution. Third, we have the anti aging crowd. People hoping to look younger, feel younger, reverse time. Stem cells can improve how you look and add recovery and energy if you're dealing with actual inflammation or degradation. But they're not a fountain of youth and they won't make you go back 30 years in time. Things like a facelift or Botox could be considered before doing stem cells for beauty enhancement. Fourth, we have people who want energy but refuse to fix lifestyle. If you sleep 4 hours, live off fast food, and don't move, you don't need stem cells. You need habits. Fifth, We have people with genetic disorders. If your condition is hard coded into your DNA, stem cells won't rewrite that. They may reduce inflammation, they may support general health, but they're not gene therapy. So if you're in group B, you're not hopeless. Stem cells are likely not your first step. And anyone who says otherwise, probably selling something. So next, we have the reason why you guys are here. Here's who might actually benefit from stem cell therapy. Let's call this group C, the qualified candidates. First, we have orthopedic issues. That means degenerative knees, hips, lower back pain, early stage arthritis. If the joint still has cartilage and hasn't gone full bone on bone, you could see reduced pain, improved function, delayed surgery, especially when paired with physical therapy. Second, autoimmune diseases. There's promising data for multiple sclerosis, lupus, Crohn's disease. These therapies are usually experimental or part of trials, but immune modulation is where the stem cells shine. Third, we have fatigue and inflammatory syndromes. If you're chronically inflamed, markers like CRP or IL-6 are elevated, and you've tried everything from diet to supplements, maybe stem cells can help calm the immune system. And you can get the benefit from doing this stem cells. Fourth, cosmetic and wellness applications, hair restoration, skin rejuvenation, sexual wellness. I mentioned them on Group B as well, but not because they don't work. It's just that these do work to a degree, but the results are subtle, and the price, it's often wildly inflated. Fifth, we have emerging support for neurological conditions. There's ongoing work for spinal cord injuries, Parkinson's, and post stroke recovery. And even autism is getting very, very good results. In fact, some autism clinics report reduced repetitive behavior, better eye contact post therapy. It's not mainstream yet, but there's momentum and results are real. To finish with Group C, I would like to be clear. When we say help, we do not mean cure. We're talking about slowing progression, improving quality of life, enhancing repair. That's what stem cells can offer when they're used right. Now, there you got your answer, guys. Those groups will help guide you and see where you're standing, but I'm not done with the video, and I would like to add some interesting things that I think you would want to know. So, let's start with red flags. Not all stem cell clinics are created equal, and the red flags, they're easy to miss. If they offer generic packages like a 3-day stem cell spa bundle, they're treating it like a vacation, not medicine. If there's no physician present or the doctor isn't licensed in the country where you're getting the stem cells, you're being treated outside regulation. That's dangerous. If they use the same protocol for everyone, same dose, same method, same promises, that's not customization. It's copy paste medicine. If they cannot provide lab documentation or quality reports, walk away. A good clinic is transparent. A bad one hides behind big claims. No one size fits all treatment should ever exist. Your body isn't like anybody else's. So, how do you really know if stem cells are worth it for you? Easy. Start with real diagnostics. Know what's going on, know exactly what needs help or fixing. If you still don't know what's causing your symptoms, invest in finding out. Because if you do stem cells without a diagnosis, it could work, yes, but the chances of actually targeting what needs to be addressed go down. And in this game, where everything is about stacking the odds in your favor, you cannot afford to let that valuable information go to waste. Lastly, get a consultation with a doctor, not a sales rep. And if your doctor says, hey, you're not a candidate, you thank them. That honesty is rare. And that is the only kind of clinic you should ever trust. So we've reached the end of the video. Thanks, guys. Thank you very much for watching. Don't forget to like and subscribe because the next video in this series breaks down something critical: choosing the right type of stem cell for your condition. Even if you're a candidate, using the wrong type of stem cell could waste everything. Now, if you're serious about doing this right, but maybe don't have the time to watch every video in this series, I've put everything you need in one simple place. I've included a link in the description for the full patient guide. It covers what to ask, what to look for, what most people miss before starting stem cell therapy. It's clear and it gives you exactly what you need without overwhelming you with mountains of information. Thank you once again, guys, for watching. Have a great day.